put this in the pig's bod, it would sort of hang like this if the pig was standing on its back feet. So that would look sort of like how ours looks, all right? So this would be anterior or superior on the pig. And then this surface where the, you know, more interesting looking stuff is, this is gonna be the inferior or posterior section of the liver. So the pig's liver has 4 lobes to it. I think ours has 3 or something, I don't care. And so, you know, a little bit different, but nothing really significant. So you'll remember that the liver gets about what percent of the cardiac output? A bunch, yeah, how much? 10%? 25%? 50%? Not quite that much.
All right, 52%.
Yeah, about 25.
All right.
All right. So yeah, so about 25% of the blood's going through here. So there are tons of blood vessels that we know. So off of the aorta, we are going to have a vessel that comes off that is going to go to places like the liver, the spleen, the stomach. What's it called?
Hepatic portal.
No?
Triad.
Coming off the aorta. Celiac. Yep. So off of the aorta, the first branch is going to be our celiac, and it's going to have a branch that's going to go to the liver. What do we call the branch of the celiac artery that goes to the liver? Goes to the liver. Hepatic. Hepatic what? Artery. All right. So that's going to bring in oxygenated blood and that kind of stuff, right? Then we have 2 branches off the aorta that are going to go to the intestines. What were they called? Yeah, so the superior and inferior mesenteric. So they're going to go in there and they're going to merge into a capillary bed that's going to collect stuff that's coming out of the GI tract. They all merge together into hepatic portal vein, and the hepatic portal vein is then going to go to the liver. So these structures are all going to come in, what would you guess, superior or inferior side, and why? Inferior, why? There's an artery though too. Yeah, so they're coming off your intestines, and where are the intestines with respect to the liver? Below it, right? So it would make sense that they come into the bottom part. So the blood vessels and the bile ducts and all of that are going to sort of enter and leave the liver at this spot on the bottom, which was called the... No? We don't have a hilus on your liver. No? Yeah, porta hepatis. Okay? All right. And so, on this one I can see a little fat, and if I dig around, I may be able to find the openings to things like my hepatic artery and my hepatic portal vein. So, what I'm going to do is I'm going to look for some blood vessels, and they're kind of in this fat stuff. And if I can find an opening, I can probably get in there. So here's a little opening that was cut. Now, if you look at the walls of this vessel, what do you notice about them? Those of you who are close, yeah, they're really thin. So what would we guess this probably is?
Vein.
Yeah, so that's probably our hepatic portal vein. So it probably came in here. Now look, if I poke around, the livers are maybe a little bit frozen, not tons frozen, and that might be better anyway. So I can get one to go into this lobe. I can get one to go into this lobe. Somewhere in there I can go into that lobe, and somewhere in here I can probably go into this lobe. So see how they have branches coming off? All right, so the hepatic portal vein is usually associated with an artery, and sometimes if I kind of pick around in the fat on the top, I can find where that is. So see where my probe is right now? See how wide that is? That's the vein. The arteries are going to be relatively teeny tiny things that are on the top. And so sometimes I can get them to poke out if I sort of go like this. So you see that structure in there? This guy, it's right between my fingers right now. That's going to be my hepatic artery. So comparatively, these guys are significantly smaller. All right? And so you can poke around. I can actually see a better one over here. So here's where my hepatic portal vein is, so I can feel it's about this wide if I move my probe around. And then if I look right here, see this thing poking out? That's a hepatic artery. So again, quite a bit smaller. If I palpate it, I can feel that it is thicker as well, right, for its size. It's not like the aorta, it's not like a garden hose, but it's pretty thick for its size. Okay? All right, then we know that the hepatic portal vein and the hepatic artery are gonna go into the liver. They're going to branch and branch and branch until we get the little things that will be part of the portal triad. They're gonna merge into the sinusoid. They're gonna come out through the central vein in each little lobule. The central veins all merge to give us the hepatic veins. And the hepatic veins then are gonna join in with the inferior vena cava. So we can usually see that on our livers, but to do it, we're gonna flip it over. So we're gonna look at the superior aspect of it. And so, if I look coming out, this big hole here is probably part of my inferior vena cava. And I say that because if I take my finger and stick it in there, there's the rest of my inferior vena cava. So it would be sitting sort of like this, coming down, right? And then going through this part of the liver. And then coming into that structure from each of the lobes, I'm gonna have my hepatic vein. See how that works? Cool, huh? So I can kind of feel where the probe goes into all of those different veins. And then they merge into this, and they go back to the heart. All right? All right, on the other side, the other cool thing that we see is, of course, this. What is this? Gallbladder. What is this duct that goes out of the gallbladder here? That's the cystic gut, good. And so what's in the gallbladder? Bile, good. And so what's bile for? Emulsification of fats, great. So, let's see. Julie, can you grab me a couple medium gloves? These, for some reason, this part is really, bloody. All right, so, what I did here is I, just put about 50 milliliters of water into each of these beakers. And we're gonna use this to sort of, demonstrate the function of bile here. Thank you, ma'am. And so I have this lovely thing of vegetable oil. And so I am gonna tell you that I have been using this for almost 15 years. So here we are, churning, 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 churning. And what do you notice about the oil right now? Just like if you had oil and vinegar salad dressing, it mixes. So if I let it sit here for a little while, what am I gonna notice? It separates right back up. Okay. So what we're gonna do is we're gonna, in one of them, we're gonna put some bile and we're gonna see if it makes a difference. And the answer is, of course it's gonna make a difference. But we wanna see it. So I need to have a scissors. Do you have one of scissors over there? Thank you, ma'am. She's like, no. All right, and so I have to cut this because there's not really a good way to get it out otherwise. Yeah, but I'm gonna stick the pipette in there. And then right now it's gonna ooze and you're gonna all be like, ugh. Yes, and probably not coincidentally, right? I know it. Now let's put a little bit more in there just for fun. We'll pretend that we had a, fatty fried meal. Okay, so then we put this in there and pass it around and see what you notice. Okay, remember this is what it looks like with no bile. And what we're gonna do is I'm going to let that sit, and I want you to look at it a little bit later and see what it's doing. Feeling emulsified? Yes, we are. All right, so what I want you guys to do is go back and try to find those things on your liver. You guys